Morning and welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, April the 21st. We are joined today by the manager of our epidemiology department, Ramsey D'Souza, as well as our acting medical officer of health, Dr. Shankar Nesathure. We're going to start our session today with our epidemiology summary. So Ramsey, you can take it away.
Thank you, Ashley. Good morning, everyone. Thank you for joining us for this week's Epi Summary and Media Briefing. So let's review our data for our most recent completed week. In terms of our case rates for this week has surpassed the 200 mark. It currently sits at 201 cases per 100,000 population. In terms of historical reflection, this is about where we were in terms of the middle of the month in February. Looking at how we compare to the other health units in the province, across the board, we've seen an increase in most health units. Currently, Windsor has the 8th highest weekly rate, high-risk case rate. Looking at our percent positivity, our percent positivity continues to remain high. It's above 20% again. This week, it's sitting at about 21.9%, give or take. So for this specific week, we had included percent positivity in our long-term care homes. For our most recent completed week, our percent positivity across our homes was 5.4%, which is about an increase of 1.9 from where we were in the previous week. And looking at the trend, we saw our initial peak in the Omicron wave during the later months of January, and historically we have just with where we were over the course of the pandemics and the waves, we saw an increased level of percent positivity during our first wave. Additionally, in our second wave in late 2020, but since then it's been relatively mild up until our Omicron wave in late December, early January of this year. When we look at our hospitalizations in Windsor-Essex for this week compared to last week has remained fairly stable. It has increased over the course of the week. It did dip earlier this week. With regards to how the province is doing, the province overall has seen an increase in hospitalizations related to COVID-19. When comparing our ICU admissions, it has increased in the province, though incrementally, whereas in Windsor-Essex, it has remained fairly unchanged from where we were this time last week. Now moving on to our wastewater surveillance data. For our most recent completed week, our wastewater surveillance has surpassed where we were during the peak of our Omicron wave. Our viral signal continues to remain extremely high, and that trend at this current point in time has not peaked. When we look at our deaths for our most recent completed week, we only had one death. However, for this week, due to the long weekend, we had reported 6 deaths. Across the average of those 2 weeks currently, we still see about 3 to 4 deaths on any given week. With regards to our outbreaks, we continue to see outbreaks in our high-risk settings. Currently, at the time of reporting, we had 24 outbreaks that were active, 7 that were newly declared last week, which is fairly similar to where we were the previous week, which was about 10, give or take. With some could say it's a minor decrease, but overall, we continue to see in certain outbreaks a high number of cases as well as transmission in those high-risk settings. Moving on to our vaccination status, for our 2-dose primary series, our vaccination rate once again continues to remain fairly unchanged. For our general population that's eligible 5+, it sits at 83.6%. And once again, our those among that are 5 to 11 years old continue to have the lowest coverage rates. When looking at our 3rd dose coverage rate, it follows a similar trend. Where we see the highest age groups, the older age groups having the highest coverage rates, but there's a grading effect where the younger you are, the lower the coverage rate is for that specific age group. For this specific week, we had included our fourth dose administration over time. Currently, we've administered just over 9,000 doses as of April 18th, and we've seen a sharp increase during the early months of April and into our current time as of April 18th. Overall, disease activity in the province, in the region, continues to remain high. We've seen increase in case rates, increase in wastewater surveillance. Hospitalizations also continue to remain fairly similar to where we were this time last week. And though our vaccine coverage rates for our fourth doses has increased during that same time frame. Thank you.
Ramsey, if I could just ask you to comment, I know you've commented on this in the past, of the people who died, those 6 people who died recently, how many of them were living in the community and how many were living in institutions or residential facilities?
For the ones who've passed away, I believe all 6 were from the community.
Right, and of the 600 deaths that we've had in the health district, I think we've passed the 600 death mark. Of the 600 deaths, what can you just share a general understanding of how many were community living versus people living in residential facilities?
It's a bit skewed depending on the time frame. Early on in the pandemic, we were seeing a lot more deaths in our long-term care and retirement homes. But since the onset of vaccinations in our population, that number has declined, and we're seeing more and more community deaths. I'd say if you're looking for a percentage, that's probably closer to 50-50, maybe 60-40 towards community residents now. But at one point, it was extremely high for our residents in our long-term care homes and retirement homes.
All right, well, that's very helpful. You know, I think one core message, at least from an epidemiological perspective, would be that many of the people dying of COVID-19 are people currently living in the community, and at least from a public health perspective, they're premature deaths, save for COVID. If it weren't for COVID, they would probably still be alive and be with us for many more years. And I think that's a core message. Is that a fair characterization, Ramsey?
That's correct, yeah.
Okay. Ashley, I'm sorry I went off, I diverted the agenda, but my apologies.
Not at all. We will now move into questions from our media. We'll start with any questions from Blackburn?
Yes, Dr. Nasathuri, as you know, the school board this week voted to send a letter to the provincial Ministry of Education asking them to reinstate the masking mandate in schools. Some boards have decided to try and go it on their own, but the ministry has told the school boards that they don't have that jurisdiction. Only they do, and health units. I know that you would prefer a province-wide mandate, but given our results this week, will you issue a letter of instruction on masking in schools?
Well, we keep every option open at the Public Health Service. At this point, the Public Health Service will not be sending a Section 22 order at this point today. But even more importantly, the Public Health Service has made a strong recommendation. We've recommended and communicated to our school board colleagues and leadership that people should wear masks indoors or when they can't remain consistently 2 meters away from another person at the current time. Well, that's our recommendation based on the level of disease activity. But we work closely with our school board colleagues, and we in the past have shared recommendations with them, and they have to make a decision based on the facts and circumstances if they can move forward with those recommendations or not. I am hopeful, and I remain hopeful, that the province will bring forth province-wide direction related to wearing masks indoors, including in schools and in other places where people might congregate. We remain concerned about the burden of disease in the Windsor-Essex Health District. We always have to be cautious in interpreting one or two group data items, but I think on average we're having 2, 3, 4 people die of COVID every week. There is, and that is concerning. And a substantive number of the people dying of COVID every week are people currently living in the community. And from my perspective, those are premature deaths. There are people that could have lived many more years if it weren't for the fact that they were infected and ultimately succumbed to COVID. The particularly tragic part of this is that we do have vaccines to help, and we have treatments now to help people with COVID, and they're not being, we still have lots of opportunity to improve the utilization of both of those medical treatments and interventions.
Now, having had those meetings with the leadership at the school boards and having had those discussions, their hands are tied. And the province does not appear to be ready to issue a province-wide mandate. When Christine Elliott was asked about that, when Premier Doug Ford was asked about that last week, their response was, well, we have the hospital capacity. I guess your response?
Well, you know, the Public Health Service is focused on trying to improve the health of the people in the local community, and at least at the local level. I think it's fair to say that hospitals prior to the pandemic were stretched to capacity. Before the pandemic, there were days when the hospitals were running at nearly full or greater than 100% capacity. I think the pandemic has put additional stress on the healthcare system and hospitals overall. We can ask the hospitals to comment on the waiting list, but I think the last time I'd asked for data, I think there are approximately 3,500 people waiting for surgical procedures and other procedural treatment in the health district. Hospitals at the current time, and you can ask our colleagues at the hospitals to share the more fulsome data. Hospitals at the current time and other healthcare organizations are struggling with people being disqualified from work because they have COVID or they're close contacts with people with COVID. So from my assessment, I think that hospitals and other healthcare institutions are in a tenuous place relative to the burden of COVID at the current time. The cornerstone of Go ahead. The cornerstone of medicine, of individual level patient care, is access, quality of service, and patient satisfaction. And I am very worried about access overall in the health system, and I'm worried that COVID can exacerbate those access issues during periods of increased disease activity. Sorry for being long-winded on that, colleagues.
Oh no, not at all. But much of what you're saying sounds like an argument in favor of issuing a mask mandate. If the province won't, why won't the local public health unit?
Well, I think that if we're going to have an effect, a substantive effect at this point, I think it's better that it's done in a regional or provincial-wide manner. We keep every option open at the health district, and but I think at this point in time, and we have asked the province publicly to bring forth on a time-limited basis a masking mandate or a masking direction. The medical officer of health in Niagara has asked for the same, and the medical officer of health in Peterborough has asked for the same. I think we all recognize that masking is just one additional step to try to bring the surge or the increase in disease activity to a little bit more manageable situation. But I think it's best at this point in time that the province bring forth province-wide direction on this matter.
Thank you.
Any questions from Windsor Star?
Yes, this might be a loaded question for you, Dr. Nasathuri, but given how you have repeatedly highly recommended indoor mask wearing, and yet the province is set to drop all mask considerations within a week's time, how is the public to deal with what are explicitly contrasting messages?
I think that the Public Health Service is governed by the Health Protection and Promotion Act. That's an act of the legislature. The legislature envisioned and contemplated 34 autonomous health districts, and those health districts trying to formulate public health plans that are modulated and or effectuated by local realities. So the fact that we're making recommendations at the Windsor-Essex Health District based on the data that we have and based on the best epidemiological assessment that we have is entirely consistent with what the statute had envisioned. And I think that our responsibility at the health district is to give an honest assessment, our best assessment and an honest assessment of the current situation and what we think are the correct public health approaches to minimizing the burden of disease. I remain optimistic that there will be we have continuing dialogue with our provincial colleagues, and they have to make difficult decisions as well. But I remain optimistic that we may have additional provincial direction on this item. But notwithstanding that, we'll at the local level try to do our very best to serve the people of Windsor, of the Windsor-Essex Health District.
So, Doctor, I'm not trying to put any words in your mouth, but are you essentially telling the local community to listen to you and not to the province?
Well, I think that many medical officers of health have advocated or have articulated the benefits of wearing a mask indoors. I think provincial direction or provincial guidance is providing people that option to wear it as well. We want to, at the local health district level, we want to work with all people in all levels of government to effectuate the best possible plans. And the one thing I can share is as the acting medical officer of health for Windsor-Essex and the public health service overall at this point in the pandemic, based on the level of disease activity, we recommend people wear masks indoors or when they can't remain consistently 2 meters away from other people. We recognize that that's a recommendation, and we hope that people will avail themselves to that recommendation, and we'll continue to monitor the current situation. We obviously want to continue to work with all levels of government, though, and that will be our recommendation moving forward. I also think that institutions and organizations can formulate their own policies as permitted by law. And to that extent, I think their approaches would also be helpful in managing the pandemic.
Thank you. I know these are getting tough to answer.
Well, we want to try to provide the best response that we can. The affirmative response, though, is that we're making the recommendation for sure, because like all of us, we're concerned. We're all in this together. If there's one metaphorical thing I could say is we're all in this together, and collectively, all levels of government and all institutions and all families and businesses have to work to find a resolution moving forward. If I could just share that we have to move forward recognizing that COVID is not going away. It's not going to be eradicated in the near future. I do think that over a period of time with improved vaccines, with better antivirals, that we will be able to return to a different level of normalcy. But we have to start working on that new level of normalcy. The new level of normalcy means that we need to get people vaccinated on a regular basis to bring them up to date. We have to provide additional resources at the hospital and at other healthcare organizations when there's an increase in disease activity. We have to think of strategies to prevent disease transmission during periods of higher disease activity, such as wearing masks indoors. We all have to make individual level risk assessments related to the activities we're going to do. We have to recognize that certain activities that were low risk in the past are going to be higher risk in the future. This is not the first pandemic. It's not the first public health crisis we've had to deal with. And there's going to be likely other public health challenges as we move forward. We just got to learn to make those tough decisions moving forward. But the one thing that I would share is that moving forward is not the same as us collectively acting before the pandemic. And I think that's the core positive message that I would have. We have to learn to live with COVID, but we have to make tough choices to learn to live with it effectively.
Thank you for that. Any questions from AM 800?
Ramsey, just going back to the numbers this week from the summary. So I just want to make sure I have it right. So you mentioned the high, the case rate per 100,000. It's at 201.1 cases. So we haven't seen numbers like that, I think you said, since February when Omicron hit. But then last week, the high-risk cases were up about 23%. This week, 7% from last week's number, excuse me. So is it improving in Windsor, or because obviously one's lower than the other, but how would you characterize it?
I wouldn't take one week worth of data in itself in isolation. We are also coming off and the holidays over Easter, so that could potentially give us a bump in terms of our numbers looking at like the next possible week to 2 weeks. And so we've seen at times as well where we had single digit increases in percentage points for our case rate too. So no, in terms of our summary, in terms of how we reflect and review results, no one indicator itself stands out on its own. Even when we look at our wastewater surveillance, that's actually surpassed the peak that we had in Omicron. So, overall, we continue to see disease activity, and it continues to increase in our region. I think that's the core message that I would take away. And both those indicators and the others that we've listed are indicative of that.
And then, like you just mentioned, with the Easter weekend just passing, I know the team and yourself continues to monitor and will continue to monitor to see the spinoff from Easter weekend.
That's correct. Yeah.
Okay. Thank you.
Any questions from CTV?
Yes, good morning. Given the high case count and the number of people who have already had COVID in the community, do you think people are getting the virus for a second and even a third time?
We do know that people can become reinfected with COVID. So I think that is a possibility, that's more than a possibility, that has happened. Ramsey, can you comment on if we have any data on the reinfection, or people who've been infected once and infected again?
We have seen that. We've also seen some cases that have been reinfected within 90 days. Typically, we don't see that as often, but we are seeing cases here in that region. I don't know the exact number of cases or the percentage of cases, but it has come up in our investigation.
Thank
And
you.
the one thing I would supplement that is that if one is up to date on their vaccines, the risk of them having a serious or severe outcome from getting COVID is markedly reduced. So if you are up to date on your vaccines, the chance of you dying or hospitalized are substantively reduced by being up to date on the vaccination. One of the things that we have to consider in the Windsor-Essex Health District, and Ramsey can correct me, but approximately 1/2 of the population, or 1/2 of the community, have had their vaccination schedule up to date. For most people, that's 3 injections. For some people, that's 4. That means that we have a large part of the community that's not optimally protected from COVID-19. And that's one thing that moving forward, we really have to work on, is to improve our community vaccination rates.
Thank you. And do you anticipate the burden of disease to decline as the weather gets warmer, like it's done over the past 2 years?
Yeah, I think that it's likely that the warmer months are associated with a lower burden of transmission. That's my best assessment. Maybe Ramsey could comment on that, but I think that's likely. But I think that the one thing that we've learned from the pandemic is that COVID-19 is unpredictable, but that's my assessment today. Ramsey, can you comment on that further?
It definitely does help. We've also seen when the alpha wave hit us in the spring of last year that we have seen cases around that time. Locally, we were better off because our vaccine coverage rates were actually ahead of most regions in the province. But the weather does help. But as a good doctor had mentioned, COVID is also unpredictable in terms of what it can do.
Okay, thank you.
Any questions from CBC?
No, I'm all set. Thank you.
We will move into our second round of questions. We will allow for one follow-up question per outlet, starting with Blackburn.
Yes, thank you. Another issue that I know that you're in frequent conversation with your colleagues in Toronto, I wanted to ask about how receptive they have been to your calls to reintroduce widespread PCR testing as a means of having a real picture of the spread of the virus in our community. Have they been receptive to that at all? Have they talked about perhaps offering it on a regional basis as an option?
Well, we continue to have a regular and honest dialogue and with our colleagues throughout the province, including in other local health districts and with provincial officials, both physicians and non-physicians involved in the public health service. I do believe that expanded PCR testing would be an incremental, would provide an incremental benefit in managing the pandemic. As a general construct, having a better assessment of the burden of disease is always helpful, and PCR testing is technically superior to rapid antigen testing. So it's something that we would recommend so long as there is capacity in the laboratories to do PCR testing. Some of these, there is the laboratory and the management of laboratory services is a provincial function, and we can make recommendations to our provincial colleagues, and they'll have to make their best decision based on the resources that are available, as well as whatever guidance that we might provide. But from my own perspective, I think that additional testing is worthwhile, and it would help us manage the pandemic more effectively. We always want to have the best possible data in formulating our public health plan, and reduced availability of testing has made it more challenging for us to give an assessment of the current burden of disease.
Locally, what's our capacity like at the labs? Because I know when we stopped doing PCR testing in December, one of the reasons why was so that the health unit could focus then on vaccination. Well, that's kind of leveled off now. The big rush is over. I know the mobile clinics are out there. We have the pop-up clinics, and I know you're doing fourth doses. But do you have the capacity to do PCR testing here in town?
So I'll just offer a general comment. PCR testing, the health unit overall will try to assign the right resources to optimize the management of the pandemic. and also try to manage all these other public health challenges that we have that have perhaps taken a lower priority during the pandemic. Testing does not need to be necessarily effectuated by the Public Health Service or even through the channels that happened in the past. Many tests in medicine happen at the doctor's office or at a laboratory or in other venues of service. So I think as a general construct, we want to expand testing availability if we have the resources to do it. How that's executed can vary moving forward, and that's one of the parts of normalization, is that how do people get treatment, assessment and treatment in the ways that they would get assessment and treatment for other diseases moving forward. I think that's the strategy that we have to think, and those are the honest discussions we need moving forward on how we can create a more normal way of living with COVID.
Thank you.
Follow-up question from Windsor Star.
I just need some clarification from Ramsey regarding the summary's statements on the wastewater signal. Am I correct in understanding that the wastewater signal is now at its highest point since monitoring began, that it has surpassed where it was during the previous peak, during the Omicron wave, late December, early January?
That's correct. Our viral signals are at our highest levels that we've seen since we started to monitor.
Do you expect it to go higher?
That's unclear. We really have to see what the fallout is from our holiday weekend. I know in parts of the province and the province overall, they've noticed a peak on their part, but we will continue to monitor to see what's happening on our end. I'm hopeful that that is the case as well for us locally, that we may have peaked, but we'll have to wait and see what the next couple of days to the 2 week has in store for us.
Thank you.
Yeah, if I could just supplement that, wastewater data is one part of the data elements that we monitor for burden of disease. It's a relative, I would only interpret the wastewater data in the context of other metrics, and certain metrics have a closer relationship to the burden of disease than wastewater data. So the number of people hospitalized, the number of people in the ICU, the number of people dying are probably more meaningful in metrics of burden of disease. Wastewater data adds to our understanding of that. The number of people who test positive adds to our understanding of that, and the number of people who turn positive add to our understanding of that. But we have to look at all of those data elements collectively, and collectively, I think that we are in a period of increased disease activity in the health district, and this level of increased disease activity has been present for the last 3 or 4 weeks. That's our best assessment today.
Understood.
Follow-up question from AM 800.
No, thank you. Have a good day.
Thank you. Follow-up question from CTV.
No, thank you.
And CBC.
No, thank you.
All right. Thank you all very much for joining us today. Our next scheduled briefing will be Thursday, April the 28th. Have a wonderful day.
Thank you. You as well.
All the best.
Thank you.